Family caregivers are essential to hospice care at home, and Southwest Medical Hospice Care provides the resources and support for patients and families during what can be a very difficult time. I'm here at Southwest Medical to speak with Brian Greenlee, Executive Director, all about their programming. Brian, what are the basics of caregiving?
Well, the basics of caregiving is what you're doing yourself. So when you have kids, you're always thinking about, oh, I've got to change a diaper, I have to feed them and do those types of things. Well, it's the same when you're taking care of an adult, but it happens kind of in a slower decline. So it starts off, maybe you're just doing reminders, calling mom and saying, don't forget to take your medications. Sometimes you're having to give the medications.
This is a very difficult time for families. So who exactly can be a caregiver?
Anyone can be a caregiver. So if you have adult children, they can pitch in and help with caregiving. The challenge is a lot of times is that if you have adults, parents, and you have kids, is you're caught in the middle. So you're trying to think about, how do I take care of mom and dad and how do I take care of my kids? Mm-hmm. So anybody can be a caregiver. It's just a matter of being able to find that time and also making sure that you take time for yourself.
Now, what are some of the challenges that caregivers might face?
A lot of the challenges they have is they'll have anxiety because, again, if they're balancing, I'm working, I have to take care of mom. If they have children like going off to college, or I've got to take them to school or soccer practice and those types of things. So caregivers, a lot of times they can have anger, they can have guilt, anxiety. When they're with mom, trying to take care of mom and do those types of things, you know, I'm missing my daughter's recital, or I'm not there to help them with homework, or when you're with your kids, you're thinking about what's going on with mom or dad. So they get caught into this situation where they just think that it's all on them, and we just really try to enforce to them, reach out to your friends, reach out to your neighbors. If you're in church, reach out to the people in your church. Your parents also had friends and things along those lines, and you can develop a network that supports you, and it's just important for caregivers to ask for help, but then also accept it when people give it to you.
Yes, and on the topic of support, Southwest Medical Hospice provides all sorts of different types of support and resources. What are those? So
when your loved one has gotten to the point to when they're ready for hospice services, we start with them, and some of the nice things that I think families appreciate is when you come with Southwest Medical Hospice, our physicians and nurse practitioners will come to where your loved one is at. They'll see them at home. If they're in an assisted living facility, they'll go to the facility. We come to you. So you don't have to worry about getting them ready, getting them in the car and bringing them somewhere. Our providers come to you. Our nurses come out at least on a weekly basis, and it can be once a week, it can be twice a week. As your loved one needs it, we'll be out sometimes 7 days a week. We have certified nursing assistants, and there are angels, and they're the ones that do the personal care. So they come out, they'll give a bed bath, or they'll help with a shower. They help get them cleaned up. Sometimes they're making the snacks and feeding them for you. So they come out for about an hour and take care of your loved one, and families really appreciate that. Our social workers will come out and they do some counseling and grief counseling, but they also give you all the community resources because everybody's situation is different in regards to their finances. If they're a veteran, our social workers will find whatever community resources to help the patient and the family in the situation. We have some great spiritual care people that help the family just with some of the spiritual stuff. You know, people think, well, I don't go to church. Well, it's not just about being in church. It's talking about how are you connected as a family into your community and friends and things along those lines. We have great volunteers. They come out and they'll sit with your loved one so that you can go and run errands. They'll feed them. We have pet therapy as well. And that is really just wonderful when we are able to introduce pet therapy, because a lot of times people have had dogs or cats and we consider them part of our family. And for your loved ones, your parents probably had a cat or a dog or something along those lines, but now they can't take care of it, and so they'll have depression because they don't have their fur babies anymore.
Yeah, well, they act as companions.
Exactly. So we bring them a fur baby, they light up, the family just loves it, and you know, having that interaction sometimes that just makes their week. And you know, and as a caregiver, you're like sitting there going, I'm so glad mom got to see that or be with a dog or a
Yes. As we mentioned earlier, this is a really tough time for families. So Do you all help in the process as they're figuring out what type of support or resources they might need? Because they might be saying, we don't really know what kind of help we need right now.
Absolutely. One of the nice things about Southwest Medical Hospice is we tell people all the time, if you just pick up the phone and call us, we can get somebody out, a nurse or social worker, to come out and address whatever it is and give you the resources. We're plugged in with primary care doctors, we're plugged in with specialists. We've got a great partner in our home health, Optum Palliative Care as well. We can find you the resources to get you on track so that you get that knowledge to be able to take care of your loved one.
Brian, thank you so much for having us here today.
It was such a pleasure having you. Thank you for coming.
For more information on Southwest Medical Hospice, just visit smalv.com/hospice.